think we're here today to try and inform as many veterans as we can. We're here with Dr. Bash.
Welcome, Radio Land, TV Land, and YouTube viewers and listeners. This is Dr. Craig Bash. I've been doing veterans medical opinions for 30 years, and I have dozens and dozens of these radio shows which we're going to publish on this YouTube channel, and number 1 through whatever. So thank you for listening, and here we go.
Another discussion. We had a case of Viegas a long time ago now, back in 2013. Now, what happened in that instance, VA tried to deny Mr. Viegas 1151 compensation, saying that the disability was not directly caused by his VA treatment or care. And the court said, yes, it was, because the VA facility had a duty to maintain the equipment that they were using for his care. And because of the equipment failure, he was injured. And so that, in that way, the court related it to the care. In that case, it was a grab bar. We've all seen in restrooms how they have a grab bar on the wall, okay? And the paralyzed patient uses that to lift themselves to and from the wheelchair. And that grab bar came loose from the wall and fell and caused injuries. And so,
let's talk about grab bars. Yeah. Let's talk about grab bars from the. I haven't been in the handicap. You know, I'm a wheelchair guy. I haven't been in a handicap bathroom in the last 6 months. Didn't have a loose grab bar on the wall. You know, those grab bars are a lot of use. You know, some patients are heavy, and they always. And all veterans out there.
Yeah,
those grab bars.
I've visited some facilities and restaurants and things like this, and just kind of tested them myself a little bit. And oh my, you know. There's an accident waiting to happen. We actually had one member of PVA, wherever he went, he would always make a point of checking those, and if they were loose, he'd rip them out of the wall. he didn't want anybody hurt. And then he'd go running and complaining to management. Didn't claim damage or anything, but he said, look, no, you can't. One of the worst problems with that turned out to be unknowledgeable people will take molly bolts or, you know, these sort of things and mount them in plaster or you know, drywall. Right. No. Anchor them in the studs, folks.
Yeah, that's for sure.
More dangerous. We have one of our paralyzed guys that fell out of the back of a van years ago, right? The lift van, and the quality wasn't good, and then for the head injury. So all that equipment maintenance is big deal. Risk for 1151.
Yeah, that worked out. If the like in Vegas, if the equipment failed and VA equipment used for your treatment, you gotta do that. You gotta compensate. All right. I hope if anyone does find themselves in need of seeking compensation for a disability incurred as a result of VA care, I hope that they will be very careful with the preparation of that case, because this is a complicated matter, a lot of legal questions. Was the informed consent adequate? Did it embrace this? What is or would be a reasonably foreseeable event following this procedure? You know, those kinds of questions. There's a lot of case law out there on it, so it's you're going to have the right kind of guidance to be able to wiggle your way through these caverns.
Kind of one of the universal codes is that those can be large awards, and they get very highly scrutinized. Any large award, right, Bill?
Mm-hmm. Yes. And this does include psychiatric problems too.
What was that one? Did we lose that one? We lost one. Well, I lost one years ago. It was a side effect of lithium. I think the guy was.
Oh, the lithium, yes, and yes, I recall that case, yes. And I'm going to tell on you, Doc. You're very generous, and thank you very much for trying to do that gratuitously for that widow. We didn't prevail, but she was. We definitely had a good case thanks to your donation of your generous time for that lady. It was kind of you to do that. And I was never satisfied with the fairness of the process in that particular case. Again, VA was relying on medical opinion from a physician at the facility against whom the 1151 claim is being filed, and I could tell from the narratives that this individual was writing that they were staunchly defending the honor and integrity of the facility, and that was his primary purpose. You know, this didn't seem to me that neither the position he was placed in nor the opinions that he authored were a result of a fair and impartial process, and I was never satisfied about that. I really wasn't. Yeah.
Couldn't you appeal the fact that they used the same facility? Why didn't they go to a third party or a different facility?
Well, independent medical expert. You know, the board had that authority as well, and I was satisfied that the evidence we had at that time was sufficient to grant the benefit, so I encouraged the board to grant it, and instead they didn't.
Do we go around like 3 opinions for me and 3 opinions for some other physician, right, Bill, back and forth?
Best I recall, they did have 2 different sources, both from the same facility. One person opined twice, in essence, blaming the veteran for dying.
Oh my!
Blame the veteran. I wasn't happy about that case, to say the least. You know, it's just a shame. The widow did not want to pursue it beyond that point. I did contact the family indirectly through the service officer to say maybe this is something we could argue before the court, but they didn't want to do that. Yeah.
These medication overdose or medication cases seem to be. I've had a couple of those. It's kind of hard to win, you know.
Yeah. And by the way, we were discussing paired organs and extremities a bit earlier, and if you are compensated under this Section 1160 for paired extremities, and it results in death, dependency indemnity compensation, DIC, and dependent educational assistance could be awarded. Okay. But you would not be entitled to specially adapted housing. Oh, and on that alone. I mean, you may have other bases for finding. You know, there's a provision for specially adapted housing that would say loss of use of one extremity and other disease, okay, that impairs you from ambulation. So, but you couldn't rely on paired extremities to satisfy the loss of 2 limbs for a specially adapted housing.
I gotcha.
Bill, I still have a question here about the kidneys. Suppose you lose one kidney, and then say a year later or so, you have to have dialysis treatments regularly because the other kidney is not functioning well enough to take care of everything like it's supposed to. Now, would that be considered as the loss of use of both organs?
Yes.
Oh,
yes. The manual at M21.1, Part 4 ratings, okay, II, 2K, 1C, okay, loss of use of one kidney due to service-connected disability, and involvement of the other kidney due to non-service-connected disability is sufficient to evaluate it for both.
Okay. That's what I was asking. Because I know a veteran just lost one of his kidneys. And he called me the other day, and he had been in the hospital like a month, and he said he had lost one of his kidneys, and he had other issues. And I was thinking then that if he had to have a dialysis, how that would come into play. I didn't know. But it sounds like what you're saying here makes a lot of sense.
Absolutely. You can find, look up this, the rating schedule here. Pull this up, Part 4.
Well,
I don't know how many of you use this VA self-serve, but I find it a little challenging when you hover over one section and then it gives you a list to the right of the other sections, and you have to make that mouse stay within it, go straight across till you get to the next one. Otherwise, it kicks you out. And you bounce all the way back.
That's a challenge.
Oh, I lost it again. Look at that. I'm going to go to Part 4 here. There we go. I'm getting it. Oh, my gracious.
Bill's only using one arm, too, right?
Yeah. Using one arm, yeah. My daughter-in-law asked me the other day, how's your work? And I said, well, it's a little challenging now. Well, how come? Well, it's like hit the cap lock, hit the first letter, take off the cap lock, type the next letter.
Yeah.
He's typing like I do now, Bill.
Yeah. Not having a lot of fun with this either. I am not getting it.
Get it done. Just get it done a little slower.
Oh, mercy.
That'd be loss of use, Bill.
Right.
Yeah, lots of mouse.
Can you get that service
It is
connected?
a moment. No. Well, I'm not going to have loss of use because it's only temporary.
Oh, I see.
Yeah. That was an interesting question. I got a call from some friends of mine before I retired. I got a call from some friends of mine at the compensation service. And the folks at the compensation service had their head wrapped around this question. And they said, where does it say that a loss of use has to be permanent in order to be paid special monthly compensation? And, it just happened that I had a need in the past to research the history of SMC, clear back through its entirety. And it's clear, it wasn't specified per se, but it was clear if you read the early documents that from the beginning, the intent was for a permanent loss. They had modeled it after what's called industrial insurance. I'm not sure how many folks would remember what that is, but generations ago, companies would make an arrangement with an insurance company, and the employer would have the insurance agent come in, and the insurance agent would sell an insurance policy to the employees, and it would be very, very low price. Not anyone could afford it, and it would cover an employee for certain losses. If you lost an eye, it would pay you a certain dollar amount. If you lost a hand, it would pay you a certain dollar amount. Okay? And when Congress enacted these provisions into special monthly compensation, they modeled it after that insurance policy. So I was satisfied when I did the research that it intended to compensate people for permanent losses. But then VA's general counsel back in the 90s came out with a present opinion saying that you can award the housebound rate temporarily. You know, for like if you get a paragraph 29, paragraph 30 convalescence award at 100% and you have other disabilities at 60, you can get temporary SMCS. So that's sort of like, it sort of threw a monkey wrench in the thing. You say, well, okay, well, it's S, why not L? You know?
Right.
Best of my knowledge, it really didn't satisfy the answer to that question.
What if you got Parkinson's, like in one arm worse than the other, and you can only use the one arm?
Yeah, it's loss of use. In the case of a hand, it's the ability of the hand to meaningfully, I'm adding the word meaningfully, to participate in grasping or manipulation. Okay? Grasping and manipulation. And in the case of a foot, it's the question of whether or not the foot is participating in balance and propulsion. Okay? So, that's, and I used to get calls from around the country from VA examiners, and they would kind of struggle with understanding this provision of, equally served by an amputation and prosthesis, and what that means. And what I had to help them understand for a long time was, no, it doesn't mean that he should have an amputation or that the amputation is recommended. No, it doesn't mean that. And I explained to him that, doctor, picture two of your patients walking down the hall away from you, side by side. And one has, the rather severe arthritic condition of the lower extremity, maybe, or neurological impairment. And he's sort of gimping along with the foot turned out to the side, rolling across the heel, making his way down the corridor. And the other patient walking next to him is walking optimally on his new prosthesis. And he's grown accustomed to it. It seems to be functioning well. Does that give you a hint?
Yeah.
Thank you all for listening. That ends this show. And now I'm going to zoom off.